It's been called the busiest trauma hospital in the world, and it provides a full range of medical services in this combat zone. On an average day, the trauma team at Balad's Air Base Theater Hospital will see 10 emergency cases, and on some days, upwards of 25. When the first call of the day is declared, medical providers rapidly come together and prepare to receive.
We're setting up for the possibility of 3 traumas coming in. I'm not sure what the extent of their injuries are right now. I've heard IED blasts and gunshot wounds.
Moments later, 2 choppers touch down, bringing in the wounded from the battlefield. Critical care technicians accompany stretcher bearers as they retrieve the litters from the Blackhawks.
130/70.
Inside the hospital, critical care technicians and doctors assist the patients to determine what treatments each need. After the patient is stabilized, he's moved to this operating room behind me, where a surgical team works to mend the broken. A laceration to the eyeball from an IED.
We're going to operate on his right eye.
Inside, Major Ralph Lim avoids removing a piece of shrapnel lodged behind the eye because of a high risk of affecting the patient's eyesight. Instead, he works to stabilize the eye and control bleeding.
Overall, he'll be able to keep his eyesight?
I think so, yeah. I think he'll be fine. So now we just got to close him up and make him look normal again.
When the operation is complete, the patient is moved to an intensive care ward for recovery. But the work isn't over yet for the crew.
We are going back to the emergency department. We're going to drop gear and get set up for the next trauma.
It's back to the ER for Staff Sergeant Ewing to set up to provide care for the next visitors. Petty Officer Frank Andrews, Balad Theater Hospital.
Repaired.